अगर मैं बचपन याद करूं तो आई वांटेड टू बी अ स्पोर्ट्समैन।
नी की इंजरीज जब होती हैं तो लोग बहुत सारे लोग कंफ्यूज हो जाते हैं और ट्रबल में फंस जाते हैं।
I just entered the field and first kick I heard something snapping in my knee.
सेकेंड टाइम जो ये प्रॉब्लम आती है पेशेंट्स को, जब फर्स्ट इंजरी अगर रह जाती है तो इट कम्स आफ्टर 10 to 15 years later. The moment they get an injury, they don't stop. They actually try to end the game.
Correct.
As if that is the last
Yeah.
match of your life.
Then third dog, someone suggests that he's specialist, this and that, and he's seen many cases. He's a celebrity, dog. You must go and see him.
क्यों हमारे इंडिया में ना लोग एथलेटिक एक्टिविटी में ऊपर नहीं जा पाते? नमस्कार दोस्तों, मेरा नाम डॉक्टर देवाशीष चंदा है। आज के इस पॉडकास्ट में हमारे साथ एक मेरे फेवरेट पेशेंट है जिनको मैं इंट्रोड्यूस भी करने वाला हूँ, और उनकी प्रॉब्लम जो है थोड़ी सी ऐसी है जो कि जेन्युइनली बहुत सारे लोगों को होती है। हम सर्जन्स जब बहुत सारे पेशेंट्स को सर्जरी बोलते हैं तो पेशेंट घबरा के मल्टीपल ओपिनियंस लेना शुरू करते हैं, एंड मल्टीपल ओपिनियंस में सबसे अच्छी ओपिनियन वो लगती है उस सर्जन की या उस फिजियो की लगती है कि जिसमें वो ये बोले कि जी बिना सर्जरी के भी ठीक हो जाएगा। Everyone wants to hear this. Even I also want to hear this for my patient, but many times surgery is inevitable. उन केसेस में क्या होता है कि जब हम डिले कर देते हैं तो बहुत सारी प्रॉब्लम्स आ जाती है, बट उन प्रॉब्लम्स के साथ भी बहुत सारे लोग एकदम ब्रेव काम करते हैं और उसके बाद धीरे धीरे अपनी रिकवरी की तरफ जाते हैं। किसी भी स्टेज पे जब प्रॉब्लम्स होती हैं उसको अलग तरीके से डील करने की ज़रूरत होती है, और आज के इस गेस्ट के साथ यही चीज़ हम लोग डिस्कस करने वाले हैं, कैसे उन्होंने अपनी प्रॉब्लम्स को झेला और कैसे वो अपनी प्रॉब्लम से पूरी तरह बाहर निकले इन फ्लाइंग कलर्स। सो आई वेलकम मिस्टर अनुज। सो अनुज, हाय एंड वेलकम टू दिस शो। सो ये ऑर्थोकास्ट शो है जिसमें कि हम लोग पेशेंट्स को और अपने डॉक्टर्स को बुलाते हैं और उनके साथ डिस्कस करते हैं उनकी जर्नी ऑफ रिकवरी। सो आज के इस शो में मैं सबसे पहले तो तुम्हारा एक वो देना चाहता हूँ बैकग्राउंड कि तुम करते क्या हो और क्या क्या चीज़ें अपने लिए करते हो और क्या प्रॉब्लम्स फेस किया। तो जस्ट इंट्रोडक्शन।
हाय एवरीवन, मेरा नाम अनुज बेदी। प्रोफेशनली आई एम अ लॉयर, but I'm also I call myself connected to sports a lot. I play a lot of sports. All my life I've played sports. In fact, अगर मैं बचपन याद करूं तो I wanted to be a sportsman. Just that कभी सपोर्ट नहीं मिला फैमिली का, और circumstances were such where I could not get into sports, but it became sort of my passion and I continue to be part of sports. So that is a bit of introduction about me. And right now I'm working for a sports company as well.
Okay, great.
If you want, I can.
Yes, you can.
Yeah, so I work for Puma Sports India, and I look after their brand protection program, where we capture their counterfeiting and work towards that problem for our products.
Okay, great. So अनुज, मैं अब थोड़ा सा उस एंगल पे जाता हूँ जिसपे कि तुम्हारी प्रॉब्लम शुरू हुई। मैं थोड़ा सा डिस्क्रिप्टिव वो दे देता हूँ कि हमने क्या करा गया है। सो तुम्हारी नी इंजरी से रिलेटेड एक इशू था जो कि बहुत सालों से प्रोसेस कर रहा था, जिसके लिए हम लोगों ने एक सर्जरी की है, ठीक है, एंड यू हैव कम अप विद अ वेरी गुड रिजल्ट। सो मेरा ये सवाल है कि नी की इंजरीज जब होती हैं तो लोग बहुत सारे लोग कंफ्यूज हो जाते हैं और ट्रबल में फंस जाते हैं। सो अगर तुम अपना बैकग्राउंड बताओगे कि इंजरी कहाँ से स्टार्ट हुई और कैसे तुमने क्या क्या चीजें फेस करी और कैसा गया, और इनिशियल डेज ऑफ इंजरीज टू ए पॉइंट कि तुमने 13-14 साल बाद सर्जरी कराई है, ठीक है। सो हाउ वाज द जर्नी एंड व्हाट वाज द इनिशियल इशू?
So, like I said, again, it's a sports injury. I suffered this injury when I was playing football. In fact, not playing football, that was my first attempt to play football after a good break of 4-5 years. And
कौन से ईयर की बात कर रहे हैं?
I was 27, I think, about 13 years ago. So somewhere between, I think, 2011 10, 11,
10,
and
11.
and you know, this was like I said, first attempt to play after 4-5 years, gap of 4-5 years. First time I played when I was in school, and after completing my LLB, and I started working as a professional. Evening sports game we planned, and we started. I went to play, and mentally still young and strong, without any warm up. I just entered the field, and first kick, I heard something snapping in my knee, and still completed the entire
Match.
40-45 minute match. Came back, slept. Next morning, couldn't walk. My knee was completely swollen, and it was very hard for me to walk. Never experienced something like that. Went to see a doctor first, which was close by. He saw it. He said there is a tear, some big tear, because he could see some fluid. When you touch, you could see that there is a fluid. Yeah. It was swollen, and there is a fluid around. We did few tests, and then found out that meniscus is torn, and basically 80% torn, 20% is still attached.
So मतलब इस जगह में एक बार just रोकना चाहता हूँ, because this is a very important lesson, because we have to learn from the mistakes as well.
Yeah.
So if you are not playing for a long time and suddenly you start to play, so सबसे important चीज़ है, you have to train yourself
Yeah.
beforehand.
Yeah.
So training is very important, and warm up is very important.
Correct.
Before
Very
any
true.
match.
Yeah.
So this actually is a very good take home message. ये हाँ हमें ये करना चाहिए, because we will
Yeah.
even with the first kick we can
Yeah.
land up with a trouble.
Correct.
Now another lesson which is usually a Indian story for all athletes, and मुझे लगता है कि क्यों हमारे इंडिया में ना लोग एथलेटिक एक्टिविटी में ऊपर नहीं जा पाते, is because the moment they get an injury, they
Yeah.
don't stop. They
Yeah.
actually try to end the game.
Correct.
ठीक है, as if that is the last
Yeah.
match of your life.
Yeah. True.
So that's why क्या होता है कि इंजरी पे रिपीट इंजरी होके उसी दिन ही सारा काम खराब हो जाता है.
Correct.
The first lesson is that you have to do warm up, and you have to
Yeah.
train yourself before you start.
Yeah.
And second is that you should always
it immediately,
whenever you hear something big snapping inside.
Yeah.
Okay, you can carry on now.
Yeah. So like you said, it's very important. Again, young, little bit stupid. I can say that now, because not stupid anymore. Now I've learned my lesson hard way. So yeah, warm ups and all very important. Did not do that. Suffered the injury. Found out. Now the first doc, who I went to, he said, I think we should conduct a surgery, and we should repair which is broken. And he told me, he said, this muscle you can't regrow on its own, so you need a surgery. Okay, first time in my life, suffered such a big injury, and then hearing about surgeries. Everyone around you say no surgeries, nahi karani. Your mom and dad, your cousins, brothers, friends, everyone is against surgeries. So then you start to take second and third opinion, like you mentioned. Second opinion, again, someone said surgery, at least 6 months of braces. I said braces is still okay, but no surgery again. Then third doc, someone suggests that he's specialist, this and that, and he's seen many cases. He's a celebrity, doc. You must go and see him. Now, highly recommended, and with such a background, I went to see him. He saw my case. He said, no, you don't need a surgery. You're a young fellow. I'll give you some medication. I'll give you some exercises. You do that, and you'll recover well. Now, I followed his instructions to the T. I did all the exercises. I continued to have those medication for good 6 months. And in fact, I felt okay. And from there, I think I started focusing more on my health, keeping my muscles strong, especially around my knee and leg areas. And I think then I continued my life normally. Of course, I did not play sports for 2 years. Thinking that I need to give that see you, but you don't have much of information, much of knowledge, right? You're not a professional, medical professional.
Anyways, it was way back in 2020,
Correct.
11.
Correct.
So even I think if you ask me, way back in 21, very few people were actually repairing meniscus.
Correct.
So most of the time, it was a very genuine advice that you don't go up for a surgery. You
Correct.
can wait.
Yeah.
And fortunately, you actually recovered well.
Yeah. So I recovered, and in fact, I played sports even after that, and all sort of sports. I even played football after that. Of course, did not play strictly football. I think I was always reluctant, and I was holding myself. But badminton, cricket, other sports, I was very much into it. I was very competitive. I was doing well, everything. Even gymming and all, I would go to the gym. I would lift heavy. I would lift heavy in legs. I would lift heavy in the upper body. Everything I was doing normally, and I felt normal. It's only lately say last year when I started I think feeling a lot of pain in my knee, in that same area, in fact.
This was a repeat injury, or it was just
Nothing. It was just, I think, probably I played I think for a couple of weeks I played more than I used to play. Like I was playing 2-3 hours continuously, and singles, doubles, and all that in badminton. And then in the morning I was playing cricket as well. Basically, those 2 weeks in my head, I decided it's going to be my sports weeks. And I started playing sports a lot for those 2 weeks, because it was my off from my work, and I was just playing sports for those 2 weeks, and that's when I started suffering more. I think by end of second week is when I couldn't walk the stairs. I couldn't take anything which is a little incline walk. So, in fact, I started wearing those soft braces as well, to give knee support and kneecaps and all that. Yeah, and
were they helpful? Those kneecaps?
Not, I would say, a lot helpful, but they were giving me a support, sense of a support. Yeah. So and then there were days, when I felt like, this is okay, I can do this, I can come back. And then there were days when I was like, no, this is not helping me at all. I think that's when I decided that I need to show it to someone. And I know your name because again, football injury, I suffered an ankle injury, and I came to see you. I think 2 weeks 2 months you treated me, and then I was okay. So that's when I came back to you to show my knee to you, and then you had recommended, we do test again, and
So again, I'm going to explain what was there. So what happened is, this knee injury of your old injury was actually continuing. It was going slowly. What has happened is, the meniscus and the cartilage, it gives a cushion in between the joint. तो क्या होता है कि meniscus, if it is torn, it is not going to heal. So minor injuries may heal on its own, or it may become asymptomatic, may not cause trouble, but it was a major injury, and you kept on playing. The best part is that you kept on playing, and you kept on training, and you kept on avoiding some extra sports, like football नहीं खेल रहे थे, ठीक है, you were doing other activities. So with exercises you actually got benefited. But what happens, meniscus is there for some sort of cushion inside the joint, and if it is torn, it actually increases the wear and tear of the joint. So second time जो ये प्रॉब्लम आती है पेशेंट्स को, जब फर्स्ट इंजरी अगर रह जाती है, तो इट कम्स आफ्टर 10 to 15 years later.
Okay.
So many times क्या होता है कि पेशेंट प्रीवियस डॉक्टर क्या होता है कि वो, अब तुमने बोला सेलिब्रिटी डॉक्टर जैसे बोला, भी एजेड होगा, might have stopped practicing even now. ठीक है, तो over the time 10-15 साल में either the patient changes the city, or the previous doctor stop practicing. तो उसके बाद क्या होता है कि you'll end up with a knee pain. Now you cannot go back to the same doctor. ठीक है, so what happened in your knee was, like, the inner part was actually worn out. because you are doing activities, high level of exercises, and you're continuing the sports, that's why you're not able to feel it till you overdid it.
Yeah.
ठीक है, it is like a जैसे गाड़ी का टायर wear out करता है, the
Correct.
moment you do overstraining, it start getting punches
Correct.
automatically.
Correct.
So that is a way of presentation once meniscus is injured and the patient, once a major meniscus injury, minor I am not talking about, I am talking about major injuries,
Major injuries.
they eventually will end up after 10, 15, 20 years now. Now 28 के बाद 40 is 12 years, but sometimes people get an injury around 30, 35 and they'll end up around 60s, 50s or 60s.
Yeah.
That is a period जहाँ पे knee replacement आ जाता है.
Correct.
ठीक है, so preservation is another thing. And do you remember what I did for you?
Yes, I completely remember, of course. And in fact, well, before I tell everyone that what you did for me, I want to say why, after the surgery, because I was awake throughout the surgery, and after the surgery, I remember you pulled down the curtain and said, Anuj, everything went well, and surgery is okay, and it gave me like a boost, immediately right then and there. So that's one thing I wanted to mention. And what you did for me in surgery is you repaired the meniscus, and then I think you inserted a plate.
High table osteotomy, we actually changed the alignment from
Correct.
medial joint to lateral.
Yes, because you mentioned that the alignment is going off because of course, because my surgery which was never repaired and or never corrected, and I think because my then knee of course started to adapt in a way that it started to give itself
The alignment was actually going into varus में,
Correct.
whole leg की तरफ जा रहा है.
correct.
Yeah.
So to I think recover from there, to make it better, we did the surgery where you inserted the plate to give alignment or support, and then repaired the meniscus
So
as well.
let's tell you the truth. ठीक है?
Yeah.
I'll end up seeing almost 10 to 15, 20 cases in a month with similar sort of problem.
Okay.
ठीक है? Either the ligament was torn at 15, 20, 30s,
Yeah.
or meniscus is torn, or there was a cartilage defect.
Yeah.
Okay, and they kept on lingering for longer duration, and they'll end up around 40s or 50s.
Yeah.
And now these are the people who are actually scared of surgeries because पिछली बार भी नहीं कराया और इस बार भी स्ट्रेस में आ गया अब बड़ा कुछ करना है.
Correct.
Now there is a big dilemma in between doctors as well. Getting alignment correction done or not in first surgery is a very debatable topic.
Okay.
ठीक है? Say let me give you an example. If the car's tire is worn out on one side, a part of the tire is worn out,
Yeah.
you will not fix the puncture, you will also correct the alignment.
Correct.
Okay, if it is because the alignment one side is getting worn off and you just fix the puncture, तो क्या होगा कि वो दोबारा से पंचर हो रहा है.
Correct.
So you have to correct the alignment as well. And this is a debatable topic because medicine or surgeries or medical science is actually evolving thing. So I end up seeing 15-20 patients in a month, and do you know how many patients get this surgery done? It is not even many times one patient gets it done because they will again take some opinions.
Correct. True.
And everyone wants now on the
Yeah.
second time the easy way out.
Yeah.
So I have seen patients where first surgery was not done in time. Second surgery, I advised a high table osteotomy correction of alignment and meniscus or ACL.
Yeah.
They thought it is a big surgery. Let's go for a smaller one.
Smaller one.
Just get the meniscus correction, which
Yeah.
was to be done in the first stage.
Yeah.
ठीक है? तो उन्होंने वो कराया and they are back again after
Yeah.
2 years, 3 years, or
Yeah.
maybe even 6 months after the surgery.
Yeah.
Now these patients, when the surgery fails, they feel that surgery will always fail.
Yeah.
ठीक है? So the right thing was not done. That's why it was failed.
Correct.
So to be very frank, I have done almost not less than 50 cases till now in last 4 years,
Okay.
and this is tip of iceberg. The amount of patient I see,
And
this
the
is a tip
surgeries you
of
do, yeah.
surgeries are less because
Yeah.
most of the time the other person, the senior most person, says कि चलो छोटा सा कुछ कर दे.
Correct.
ठीक है? To a point कि many of the people with HTO, if I have written HTO, they have deposited the money in the hospital and they have not turned up for the surgery.
Oh wow.
ऐसा भी हुआ है. ठीक है? So मुझे लगता है कि दिस अवेयरनेस इज मस्ट नाउ। मुझे एकदम सच बताना है, ठीक है? व्हाट वाज द रिकवरी फेज?
Yeah.
हाउ मेनी डेज लेटर यू
Yeah.
वर एबल टू कम आउट ऑफ द बेड?
Yeah.
पूरा डिटेल बताना, बिकॉज इट इज
True.
मोर इम्पोर्टेंट फॉर अ पेशेंट टू अंडरस्टैंड दैट
Yeah.
हाई टेबल ऑस्टियोटोमी is not the high table osteotomy done in 80s. Basically ये करते थे हम नी रिप्लेसमेंट को बचाने के लिए पहले, अब इट इज बिकॉज मतलब कि स्पोर्ट्स इंजरीज के लिए कर रहे हैं। पहले होता था कि उसमें बेड रेस्ट होता था 6 महीने का, अभी नहीं होता है। तो तुमने क्या फेस किया एग्जैक्टली वो बताना।
ठीक है। सो फर्स्ट थिंग, आई वाज वेरी श्योर कि मैं सेकंड ओपिनियन के लिए नहीं जाऊंगा, बिकॉज एंड आई ट्रस्टेड यू फुली। आई वाज फुली श्योर कि मैं एक ओपिनियन लूंगा एंड आई एम गोना फॉलो दैट। एंड व्हेन यू सजेस्टेड दैट वी आर गोना डू दिस, आई वाज कंप्लीटली इनटू इट। आई वाज ओके, मेंटली प्रिपेयर्ड कि दिस इज व्हाट हैज बीन सजेस्टेड एंड आई एम गोना डू दैट। I think 10th of January is when we did the surgery, and it was morning time, and evening you came and you said get up from the bed, and I was up from the bed. Imagine, same day, same evening, I was up on my 2 feet, standing, but still with the help of course, staff around. But once I was standing without any help, nothing. I think that gave me a huge pump and huge, I think, motivation and positivity. And I decided this is brilliant. I think let's work on it.
I've made this as a benchmark point.
Yeah.
That whatever surgery I do, whatever surgery, if it is a knee replacement, hip replacement, or a repair surgery, or a
Yeah.
STO, DFO, anything,
Yeah.
I make sure that the patient should stand in the same evening.
Yeah.
That gives a positive.
Absolutely, very true.
Yeah.
That
Because-
gave me a huge pump.
because
Yeah.
you are with a mindset of background. Everyone is saying, सब लोग बोले कि अरे यार तुम बिस्तर पे पड़े रहो,
Correct.
पड़े नहीं रहोगे.
Yeah.
Orthopedic surgeries have changed.
Yeah.
Because I have myself seen, and मैंने खुद बोला अपने पीजी टाइम में कि अरे बिस्तर से मत उठना, ये टूट जाएगा.
हाँ.
ठीक है, एसटीओ हम लोग जब करते थे कॉलेज में, मैं खुद
Yeah.
बोल रहा हूँ कि मैं 6 महीने तक, जब तक एक्सरे में पूरा बोन यूनियन नहीं दिखता था, I used to tell my patient not to come out of the bed and put weight on the thing,
Okay.
which has completely changed.
Correct.
ठीक है, in last 20 years it has changed like anything.
Yeah.
Technology has changed and we
Technology
have
has
actually
changed.
evolved.
Yeah, absolutely. I think because we are learning about human bodies, and it's
Yes.
a miracle.
So
in
that's
itself.
the point which I have made it at
Yeah.
as benchmark, that by the evening the
Yeah.
patient has to stand.
Yeah. And next day onwards, I think we started a little bit of physio as well, and that's also one point where I think I mentally was very focused that this is what I'm gonna do. I'm gonna retrain my knee. Someone told me, I think, that once you get a knee surgery, your knee will be almost as same as when you were born. It's as fresh as when you were born. And you need to retrain it to make it useful as you are, adult now. So in my head, I was very sure and very positive that now after surgery is done, that is half of the job is done. Now half of the job is on me, where I need to retrain it and do proper physio, proper exercise to make the muscles stronger, for the tissues to connect stronger, regrow stronger. I think probably that's also part of my, I think, little bit of knowledge of playing sports and gym activities and all that I've done over all my life. So I applied that and I continue to do physical fitness and my recovery process was hence smooth. I think probably initially first week was a little hard, but every passing day it kept on improving, and then I think you told me, I remember that I'm probably the only person to have or probably starts walking or playing sports. In fact, I want to mention one more thing. I think within 13 days, I sent you a video where, initially I was walking with the help of a walker with the support. And in my home, I kept that walker aside and I started walking.
Yes.
And you said, be careful, don't do that right yet. Let your bone heal. But continue to do your exercises and walks. And then I followed and I continue to walk with the help of walker for I think a month. You said 6 weeks, but I think after the
first X-ray, I think we were through.
Yeah, exactly. I was like, I don't need it anymore. In fact, I started coming to your center to get the physio done within I think 5 or 6 weeks. So, which was
what was your thinking about that physio rehab thing?
I think it's a must.
About Dr. Sonam.
Oh, she really helped me as well. So, I think you did a fantastic job on my knee, and after that, I think she almost worked as hard as I did. She was there regularly every day to help me do my physio. Even guide me as well, because a lot of times whatever I needed to know, she was able to help me because she was meeting you every day because part of your team, right? And whatever questions I had, I was able to ask her and she was able to guide me that way. And so I think that's also very important.
मैं राज की बात बता रहा हूँ कि सोनम ना अब तक डॉक्टर सोनम अब तक किसी भी पेशेंट से ना मतलब it is always ऐसा होता है कि Sonam is not happy with the patient because patient is not putting full effort according to her, and the patient is always complaining to me कि Sonam is too harsh. ठीक है, and you are the only patient जहाँ पे कि Sonam actually never said anything. She said कि he is doing very good, and I was actually skeptical कि why she is saying very good. कुछ गड़बड़ है, कुछ तो नहीं है, and you are very well. See, this is actually a pillar of a pyramid. तीन pillars होते हैं, which I feel as a surgeon and the patient and the physiotherapist.
True.
They are actually pillars of success. If everyone works according to their need, demand जैसे काम करते हैं ना सब लोग मिलके, so it is always going to be a successful result. And which I felt in your case was actually one of the reasons. It is not me being good, it is not being Sonam, it is not. You have given your full effort in doing the exercises, and that's मुझे लगता है कि one of the big achievement है जिसके कारण you were able to play cricket even. Cricket कितने दिन में खेला था वो बताना है.
I think 2 months. Within I think completion of 2 months is when I played my first match. Of course, I did not do well in that match. But I think third or fourth match, I even got a man of the match award.
Man of the match.
Yeah, so that was also a very exciting day for me right after the surgery. So I think thanks to you and thanks to even Dr. Sonam, I even say that to her now that whenever I see her that it's always thanks to you. But she, like you mentioned, she tells me that it's all your effort. We were guiding, we were doing everything.
Sonam is the person who has seen maximum number of STO and DFO patients, osteotomy patients. She is the one, and she is never happy with any one of them. Okay, though they are doing well, her benchmark is very, very high.
Correct.
And with you only, she never complained. She said, "Sab theek chal raha hai." And I was like, "Sab theek chal raha hai." मैं इसे मानूं या नहीं मानूं? But results were in front of us. Definitely yes. So if I ask you now, this is how many months after the surgery?
Almost 7 months.
7 months down.
7 months, yeah.
So say 13 years of issues, 13 years of injuries. Last 1 year of 1.5 year of knee pain issues, ups and downs, and getting a surgery done after 7 months. What is your thinking about knee injuries now?
I think we should not be afraid to get surgeries done now. Even I think I read about, of course, because now I got the surgery, so you read about it, you try to find out about it more. I think the technology and the knowledge out there is so much that I think you can easily trust surgeries. And getting these kind of surgeries is in fact better than knee replacements. If you can get these done and not look into knee surgery, knee replacements, that's the best.
That's the best part of it.
Yeah, and I remember when before getting the surgery done, that you said ask me any question you want. what I ask you is, I want to get back to sports, and if I can play sports, I'll do this surgery. And if you tell me you won't be able to play sport, I will not get the surgery done, because then whatever I have, I will play sports with that, and then I'll
finish it up.
finish it up as a one leg guy. So you said no, you will be able to play sport, but you have to follow everything to the T, and that's was what I think focused me. That all right, let's do it, because it will help me in long run.
So again, Anuj, last question. ठीक है, a lot of patients, बहुत सारे patients हैं जो बहुत डरते हैं, ठीक है, इवन सर्जरी के नाम से डरते हैं. अलाइनमेंट करेक्शन बोलने से, मतलब कि बोन को कट करके सीधा करेंगे बोलने से तो और डरते हैं.
और डरते हैं, हाँ.
ठीक है, उन लोगों के लिए क्या मैसेज देना चाहते हो? बिकॉज आई फील वट एवर वी सर्जन्स और डॉक्टर्स से पेशेंट से टेल द पेशेंट टू डू गेट द सर्जरी, बट दे आर स्केयर्ड. ठीक है, एज ए पेशेंट being a brand ambassador for one of the successful surgery, so what do you want to say to those who are actually scared of surgeries?
I think don't be scared, because I think and I think the technology out there, the knowledge out there is probably at its peak right now. So take the benefit of it, and sort the issue out, and then live your life normally. I've started playing sport, which is huge for me, and even in my normal day-to-day life, I'm improving every day here again. I won't say that I'm at my 100% as of yet, but I'm still 70-80%. Which is allowing me to play sports normally and grow from here. And I think in my head, I think I'm giving myself another 1.5 years, and I will be probably close to 100%. So I think just sort the issue out and listen to your doctor. I think right now that message should be out there, that listen to your doctor, listen to your physician, and physio as well. Surgery is not the only answer.
It is actually a team effort.
It is, absolutely. I think it is all multiple factors combined together. You being positive, be a half glass full person, which I am. I think that's also very important, because more positive you are, I think that's what it helps the body to recover as well. So be that, listen to your doctor and get the surgery done. No problem. Even now I probably promote it.
Yeah, great Anuj, I am very happy for you. And बाकी लोगों के लिए ये message है कि they should not be scared of surgeries.
Yeah.
But I tell my patients usually कि आपको अगर कोई surgical procedure बोलते हैं, you go and read about it. Read about the thing. Okay, you gather your information. Okay. Yes, you can ask multiple people. Few people will say nahi karana hai. Ask them why.
Yeah.
Write down the questions. Somebody who got the surgery done, talk to them. Okay. They will say you should get it done because of this reason, or you should not.
Yeah.
Then write it down. Make a list of questions and meet your doctor again. Pucho सवाल.
Yeah.
Okay. See if your doctor is giving all the correct answers or not, or he is able to satisfy you or not. ठीक है. ये करने के बाद give a full effort for the post-operative rehabilitation.
Yeah.
But do not get confused. ठीक है, if you are confused, then your confusion can be removed by the surgeon only. Go and meet him and talk to him. Many times लोग कहते हैं कि नहीं सर्जरी इन्होंने बोला दूसरे ने बोला, मैं कंफ्यूज हो गया, क्या करूं? ना करना ही सबसे इजी है.
Yeah.
क्योंकि उसमें कुछ करना नहीं है.
Yeah.
ठीक है. But I think as an example, injuries not treated in time leads to a bigger surgery.
Correct.
And if again not treated in time will lead to knee replacement surgery. Though I am a replacement surgeon, I am more keen towards preservation of the knee.
Correct.
Okay, because most of my patients are young.
Mm-hmm.
And I feel that if we can save even one knee with this episode of podcast, and somebody get help out of it, it is going to help us in long run.
I'll be very happy.
And I'm very happy that you came to this show, and
Thank you so much.
you have taken this pain to come to us and talking
No
to me.
pain now.
No pain. So thanks Anuj, and I wish you luck, and
Thank
I feel very happy. क्योंकि मुझे लगता है कि जो लोग ठीक हुए ना वो लोग अगर दूसरों को बोलेंगे तभी बहुत सारे लोग सफरिंग से बच सकते हैं, rather than इंडिया में एक कहावत है कि लोग ना जो अच्छे होते हैं वो कभी बोलते नहीं है क्योंकि उनको लगता है कि शायद किसी की नजर लग जाएगी और खराब हो जाएगा। बट मुझे लगता है कि नजर नहीं लगेगी अगर हमने दिमाग से और सही से काम किया तो नहीं लग जाएगा। एंड थैंक्स फॉर कमिंग एंड थैंक्स फॉर वाचिंग दिस पॉडकास्ट। एंड इफ यू लाइक दिस डू लाइक एंड शेयर इट टू समवन जिसको जरूरत है, उसको अगर ऐसी कोई प्रॉब्लम सफर करे मेनिस्कस की ओल्ड इंजरी, देन डू शेयर हिम एंड डू लाइक आवर चैनल। थैंक्स।